Pleasant good morning to everybody. I am Dr. Bernard Gargamosa and I am a psychiatrist from the National Center for Mental Health in Mandaluyong City. And I am also the current program director of our very own 24/7 crisis. And it is indeed an honor and a privilege to be invited by the Nueva Vizcaya State University to become part of this important celebration and for me to be able to share my experience and expertise when it comes to mental health, especially during these pandemic times. I would also like to acknowledge first the Office of our Medical Center and the special concerns of Office of the NCMH for allowing me to be with you here today. Kudos also to my colleague, Dr. Casino of the DOH NCMH for assisting me in the preparation of these slides. And also the workbook COVID-19 by Dr. Nakasawa. And of course, then again, Vizcaya State University for inviting me this morning. So what are the objectives in this morning's lecture or webinar? One is to provide an discussion about mental health in relation to the pandemic, population most affected and how, the special focus on the psychological aspect together with some statistics. But the meat of the discussion will be on the highlighting the importance of emotions and cognitions in understanding our reaction to the pandemic and of course, healthy ways to cope with the current matter. It has been what, 2.5 years since the onset of the pandemic, and they say that we are on the same boat in this pandemic. Do you believe this? Do you agree? Technically, we are not. We are in the same ocean, but not in the same boat. The ocean is the pandemic, COVID-19 pandemic itself, but we have different reactions to this vast ocean of a challenge, and that is COVID-19. In my private practice, I have seen a significant increase in my clientele. Some are able to cope with just psychological reassurance. Some are able to cope with medications. No? So, iba-iba po. No? I would like to share this slide, no? This picture that in I think August 2020 from Channel 2, from ABS-CBN. I was interviewed then and I was asked regarding the pandemic and its long-term effect. I said that the lockdown itself caused less interaction to no interaction. The COVID-19 pandemic is just the tip of the iceberg, being a medical issue, but it is going to be more of a mental health issue in the long run. And I think I'm right. No, I'm right when I mention this because although the numbers when it comes to the infected keep on rising, the psychological effects, I think, are more staggering. Hindi siya nakikita sa actual numbers, sa deaths, the recovered, the infection, but mental health has been highlighted by COVID-19. And that's a sad reality. Sad reality, but later I'll be explaining some of the positive aspects of COVID-19 as far as mental health goes. So, as of the latest count, 2022, we have 381 million infected, 5 million deaths, although the recoveries is also high. In the Philippines, we just had the different variants. No? The last variant that we've had is, tingnan natin, ano nga yun? the Omicron variant, no? I hope this is going to be the last variant, but who knows, no? But we're hoping for the best and praying for better times to come. We thought Delta was the worst, but I think Delta is far worse compared to Omicron. Mas infected by Omicron, but less yung deaths. During the during the start of this pandemic, sino ba yung mga na-affect? Who are the most affected? Those who are associated with health, those with economic reasons, and socio-cultural reasons. Sino ba yung mga associated with health? Kami po sa mental, kami po in charge yun sa mga na-quarantine. Nagkaroon ng time, nagtayo na kami nagtayo na kami ng ambulances sa mga hospitals, sa mga hotel facilities because of the quarantine OFWs, no? Grabe yung effects nila, maraming nagwala doon. But also, people who are immunocompromised, older people, di ba? Marami sa kanila yung may sakit na hindi natignan with disabilities, and of course, the frontliners. I myself is a victim of COVID, no? That infected April, mga March or April, parang somewhere along that line na marami ang affect frontline health workers. Sino pa? Yung mga nasa economies, workers of hard-hit industries, hospitality, tourism sector, no? Sino yung mga naapektuhan pa? Yung mga nawalan ng trabaho sa schools, mga school bus drivers, jeepney drivers. No, it led to a reduced household income, instability. Maraming natanggal po sa trabaho kasi nga tinatamaan ng COVID yung mga elderly. So yung nagkaroon ng some sort of ageism, no? Bias against those who are 50s and above, no? Natanggal sila. Also, the young people trying to enter the job market. Kasi papasok pa lang sila, pag-hanap ng trabaho, nagsara ang economy. And of course, solo parents, no? Sole parent families. Sino pa yung mga naapektuhan? Because of social cultural reasons, people who may feel socially isolated. Sino tong mga to? Yung mga may sakit na ng mental health. Mga dati ng pasyente. O yung mga dating nadi-discriminate dahil sila ay may kakaiba kanila. No? Maraming mga mentally ill patients na hindi nabigyan ng gamot, hindi na-check up. Kasi ultimo National Center for Mental Health nagsara. And also, of course, those who have difficulty accessing digital tools. Ako hindi ako techie, no? So maraming nahirapan kasi work has to nag-work from home. Paano kung walang internet sa bahay? Hindi marunong mag-internet. Ito yung mga apektuhan. Nakalimutan pala natin ilagay. Mga students and workers. Siyempre, nawala yung sarap ng social interaction in school, na pressure sa modular, na pressure sa online classes, no? Sorry, hindi ko kayo nalagay, pero I have a lot of clients who are students and teachers alike. Magulat kayo. What were the psychological consequences of COVID-19? Anxiety, depression, confusion, anger. I'm not saying that these are all disorders, but these are symptoms which are known psychological consequences of COVID-19. Lahat tayo at this point nagkaroon ng ganito. Right? The psychological impact of COVID-19 in the Philippines in a study conducted, 1,879 online surveys. Grabe yung reported anxiety ng mga respondents, 1/4. And 1/6, iba yung impact nito when it comes to depressive and psychological symptoms. At the National Center for Mental Health, makikita po ninyo, we started 2019, 3,000 na yung calls namin. Pero nakita nyo yung increase. At ang nakakatakot yung more than 100%, 300% increase in those callers who have suicidal risks, no? taas talaga. Yung age distribution niya, 18 to 30 pa rin yung pinakamataas, pero makikita nyo, yung mga less than 17, grabe yung increase niya from 164 to 424 to 1,200 in 2021. What were the top 3 reasons for calling? Anxiety and depressive symptoms. Nangunguna talaga siya. Kaya nga po we leveled up our services, not a initial call lang sa hotline. Nagkaroon ng time, kailangan na namin silang bigyan ng higher level of intervention kasi hindi kaya talaga yan sa isang tawag. While COVID-19 has been devastating, it has highlighted the importance of proactively recognizing our own mental health and well-being. It also provides an opportunity to remove old thought processes or stigma relating to mental health issues. Ito po yung binabanggit ko kanina na napaganda pa din because na-highlight ang mental health during COVID-19. Napag-usapan siya at nagbigyan po ng importance. So we are now 2 years into the pandemic. Tama ba? Oh, going 2 years this March. So how are you feeling right now? When you say emotions, it refers to our natural responses to stimuli that shape our influence and dictate our behavior. No? Emotions can lead to discomfort or discomfort. We have to understand that this is a universal fact. Emotions, thoughts are just like visitors. They come and go. We should embrace the negativity, not just the positivity in our lives, but also the negativity. I'll be explaining that later. So, what are the steps in regulating our emotions? So, number 1, observe and notice. In fact, punta na agad tayo dun. When you're feeling something bad, something strong, uncomfortable, alam natin yun eh. In fact, yung mga anxiety patients ko nga, they go to that letter B. Pag tinanong mo ng mga anxiety symptoms niya, lahat na naiisa-isa niya. No? Paano ko na-identify na natin? Anong sunod natin gagawin? We need to go up. Ask yourself, what am I thinking right now? Look and ask yourself, what are the negative thoughts I'm thinking about? For example, meron po akong depressed client na pupunta sa akin. A student to, depressed siya, malungkot po ako to. So, we're going by the steps, no? Yun yung na-observe niya. Malungkot siya, ang sama ng pakiramdam niya, ayaw niya makisalamuha, withdrawn siya. Alam niya, identified niya, Doc, I'm having depression, I think I'm having anxiety also, I'm having sadness, I don't want to be with people. So yeah, identify niya. Ano yung tinanong ko sa kanya? Anong negative thought mo? Paisip siya. Doc, takot ako. Feeling ko I will not survive school. So, ano ang madalas mo naisip? Hindi ko kaya to. That's the negative thought. Ano na gagawin natin next? Is it a thought or a truth? Hindi lahat ng naiisip natin dito to. Not all of our thoughts are truths. So negative thoughts need not frighten us, but instead be validated. Totoo ba ito? Yung tinatanong sa client. Anong evidence mo? Na-identify na natin. Takot ako, feeling ko wala akong kwenta, hindi ko kakayanin na matapos tong school. So, is it a thought or truth? One technique, look for the evidence. Yun yung validation. Tinanong ko siya, anong evidence mo na hindi ka makakasurvive? Dok, hirap ng online. Dok, parang hindi ko naiintindihan yung mga sinasabi ng teachers. Hindi ko naiintindihan yung lesson. Anong evidences mo na hindi totoo yun? Actually, Dok, okay naman yung scores ko. Nakapagpasa ako. Actually, Dok, achiever ako dati. Sabi naman nung mga professors ko, ng teachers ko, I'm doing it. Bumalik yung scores, okay. Nakita niyo yung weighing. Evidence show that Mali yung thought. It's not a truth. It's just a thought. So, nung sinabi ko sa kanya, what can you say now that the evidences are pointing strongly against the iniisip mong mali, ng negative? Ayaw nga na, Dok. Mali pala iniisip ko. So, anong mangyayari pag ganun? What happens to most clients that go to me, the negative thoughts, yeah, the feelings, alam nila, yung thoughts nakita niya, pero walang validation. Dahil pangit yung naisip ko, negative thought, totoo yan. Dahil totoo yan, hindi ko talaga kaya. Hindi ko na maintindihan. Lalo siyang natakot, lalo siyang nahirapan mag-focus, hindi makatugima ka. What happened? Ending. Nag-trap siya. Nung binalikan namin yun, hindi pala. Mali pala yung iniisip ko. Okay? Di ba? Some of you might ask, Dok, paano if the evidence points otherwise? No, tama. Tama yung thought ko na negative. For example, I have a client, hiniwalayan siya ng kanyang partner. Lalaki to. Iniwanan siya ng asawa niya, pati mga anak. Came to me, very depressed. Negative thought niya, I'm a failure as a husband and as a father. So, sabi ko, let's look at the evidence. Paano mo nasabi yun? Dok, may bisyo ako, nasaktan ko yung asawa. Kaya ako asawa. Hindi. Tama pala. Tama, hindi pala siya negative thought. It's a truth. What's next? Problem solving. Sabi ko sa kanya, alam mo pala yon, ano ang tingin mo dapat gawin? He went into rehab. Sabi ko, mag-rehab ako. Babalik ako sa trabaho. Susuyuin ko sila. Problem solving. Patunayan niya na yung thoughts niya na negative at totoo pala, truth pala, then problem solving. Okay. The last pandemic the world experienced was during the First World War. And the world is not ready for such. Not yesterday, certainly not today, sabi nga ni Bill Gates. I remember that interview. That humanity is not ready for a global epidemic. No? Parang prophetic. No? Kaya po, napapansin ko na daming nag-away sa atin. No? DOH, nakaaway ng DOH. No? Iniisip ko talaga na kahit sino talaga ilagay mo dyan, yung response talaga magiging mahirap. Why? Because this is something new. This is something hindi natin ina-expect. But we have to learn from this. No? Kasi hindi, sabi nga ni Bill Gates, this is not just one virus. We will be experiencing other viruses. Dito pa nga, variants pa lang, nagkakahirap-hirap na tayo. How much more additional viruses? Right? So, radical acceptance. It involves accepting the present without an intense desire to change it. In the case of COVID-19, stop fighting the reality, stop resenting that reality is not the way you want it. Let's start letting go of the bitterness. Meron akong mangilang-ilang clients, students. Ay, ako na pumasok doon. Papasok na lang ako pag wala na yung COVID. I don't believe in modular. I don't believe in virtual learning. Sabi ko sa kanya, hanggang kailan ka maghihintay? Hindi niya masagot. Basta Dok, ayoko. Actually, yung dalawa bumalik sa akin after a few. Dok, gusto ko na pumasok. Sinabi ko sa kanya, what changed your mind? Dok, the uncertainty. Hindi alam kailan. And I'm willing to give it a try one more time. Diba? Ganun talaga. We have to look at life now in the context of hindi natin alam what will happen in the next few weeks, months, or years. But you have to enjoy it now. But life is still beautiful and worth living. Through coping mechanisms. Radical acceptance through coping mechanisms. What are coping mechanisms? These are defined as emotions, thoughts, and behavior that assist to reduce psychological stress by individuals that promote mental health and well-being. Coping is different from emotional escape because the latter involves impulsive acts aimed at deflecting the problem only to cause or to lead bigger problems. Ano yun? For example, avoidance. Ano yung mga strategies of avoidance? Alak, bisyo, okay? Numbing, dahil naiinis ako sa COVID na to, dahil naiinis ako sa sitwasyon, hindi na ako makikipag-usap sa mga kaibigan ko, mag-iisa na lang ako. I'd rather be withdrawn than be with people. And mas nakakatakot yung anger. Nagwawala sa bahay, nag-a-guess, nagdadabo. Strategies for, is this healthy or unhealthy? Definitely unhealthy. So, what are the healthy ways to cope with stress and anxiety? Number one, biological. Know what to do if you're sick and are concerned about COVID-19. Contact a health provider before you start any self-treatment. Let's focus on COVID. Hindi na nalagay dito, pero vaccination. Ang dami pa rin pong hindi bakunado. Ang daming natatakot. Nakakainis man, isipin, pero kaibigan akong doktor, dentist. Dok, dami ko kasing nababasa. May mga kaibigan ako sa US, sa UK, mamamatay ka ganito. Sabi ko, ilan ba ang binakunahan? Ilan ba ang namatay? Ilan ba yung sinasabi mo? Wala. Kung gusto nyo makabalik tayo sa dati, vaccination is the key. Okay? Know where and how to get mental health treatment and other support services and resources, including counseling or therapy. Yun po hotline namin, meron po yan. Meron po akong good news sa Vizcaya later. Take care of your emotional health. It will help you think clearly and react to urgent needs to yourself and your family. When you say taking care of your emotional health, kailangan po yung awareness. Alam po natin kung tayo normal ba o kung nakakasakit na tayo ng ibang tao, hindi maganda ang pakiramdam natin sa ginawa natin. That's not emotionally healthy. Okay? Take breaks from watching, reading, or listening to news stories, including those on social media. I think medyo nanawa na din tayo, no? Tumigil na rin yung DOH sa pagbibigay ng daily census nila. Kasi nakaka-upset lang, no? Mas maganda po na makinig tayo ng mga success stories, ng mga good news, no? Kasi yung para tayong nag-aabang ng result ng loto. No? Dati ganun, ilan na ba tayo? Ilan na ba tayo? Yung kakatanong natin na ganun, ang dami tuloy mas stress sa atin. Tama? So, the COVID-19 pandemic has led us to focus more on taking care of the body, di ba? Ayaw mo magkasakit. Eating, yung mga sinasabi sa atin ng mga nakatatanda sa atin, nung bata tayo, ito yung paulit-ulit na sinasabi ngayon. No? Take care of your body, eat healthy, exercise, avoid alcohol, and sleep. But also, time to unwind. Nakita nyo, ano yung mga nauso? Plantito, plantita, TikTok, kakatulong yan, maganda yan, one way to unwind, no? But the pandemic, initially, WHO to, sinabi nila, maintain social distancing. After a few days, binago nila, physical distancing. Why? We can be physically distant to prevent the virus transmission, but we should always be socially connected. So, talk with people you trust, get a phone call, chat, message to mga classmates natin dati, friends, no? Maintain the connection. Connect not just with friends, but also with community or faith-based organizations. Hindi po masama kahit kailan yung ating spirituality. Diba? Magkakaiba man po tayo ng paniniwala about dogmas, about anong tawag dito, mga practices, but we still believe in a higher being. Diba? Remember this acronym, accepts, na? Activities, contributing, comparisons, emotions, pushing away thoughts and sensations. Activity, gaya nga sabi ko, no? Yung iba, nagplantita, activity nila. Yung iba, nagpa-vlog. Yung iba, they engage in activities that would help calm their mind, no? To beat the stress. Yung iba, nag-bake, nagluto. So do an activity you enjoy probably and to achieve something that could boost your self-esteem. Wala pong masama doon. Yung mga dati yung activities pa kayo. Gusto ng mag-aral na magsayaw, mag-zumba. Do it. TikTok, sige. Contributing, focus on someone or something other than yourself. Now, volunteering time to a cause you believe in improve your well-being and life satisfaction and may even reduce symptoms of depression. People who perform acts of kindness towards others not only get a boost in well-being, they're also more accepted by their peers. I'm willing to work with Nueva Vizcaya State. Tayo po tayo ng mental health unit natin, yung psychosocial support para po we can give psychological first aid doon sa mga students, sa mga faculty, and even doon sa community, no? That need psychosocial support. We are also at the NCMH, we can also work on a suicide training, prevention training and education para magkaroon po tayo ng not just psychological first aiders, but suicide first aiders, no? And if students would like to be trained, wala pong problema. Let's just talk about it and we can schedule it. Comparison. Look at your situation in comparison to something worse. Remember a time when you were in more pain or when someone else was going through something more difficult. Yung mga problema po natin ngayon, pag may problema tayo, like sinasabi sa mga clients ko, this is the first time nagka-problema tayo. Kaya yung last time na mabigat, anong ganito po? Anong ginawa mo? Kasi gagawin mo ulit ngayon yan. Diba? Yung mga problemang napagpagpasan natin dati, we have learned something in the past. Learning daw is the application of what you have earned in the past na pwede mo gamitin in the future, in the present. Walang learning pag walang change in behavior. Remember that. So, lagi niyong isipin, ano ba yung mga naging problema ko dati? Ano yung ginamit ko? Spirituality, prayer, love of self. Ito yung mga techniques ko dati. Ito rin yung gagawin ko ngayon. Ito rin yung gagawin ko next. Emotions. No? As I said, welcome our emotions. Let's welcome emotions, whether it's positive or negative. Why? Because it's a part of life. Ito yung isang problema ko sa mga clients ko. Pupunta sa akin. Dok, ayoko itong emotion na to. Hindi ko kaya to. Sinasabi ko na, embrace the negative emotions. Why? Kasi that's part of being human. Hindi tayo magpo-focus sa emotion. Dito tayo magpo-focus. Paano natin yan i-analyze? Do something that will create a competing emotion. May masamang masama ang loob mo, pinagalitan ka ng teacher, pinagalitan ka ng coach mo, ng superior mo, ng magulang mo, watch a movie. Feeling nervous, listen to soothing music. Diba? Kaya nga Netflix, pumutok nun eh. Initial ng pandemic, diba? Ang quarantine, grabe ang Netflix. Up to now. Welcome negative thoughts and emotions. As I've said, do away with negative thoughts by pushing them out of your mind. Hindi. What we do with negative thoughts, tanggapin natin. But we have to validate. Okay? Iba, they write their problems on a piece of paper, crumble it, tinatapon. And then, but not all of our thoughts are truths. Always validate. Yun yung symbolism lang naman yung paper eh. Nagsusulat sila tapos tinatapon. Okay? So, when your emotions take over, try to focus on something else. Count something in the room, read. Sinasabi ko to sa mga anxiety. Mindfulness. Sa thoughts yan eh. Pag kinakabahan ka, pwede kang pumikit, no? Pakinggan mo yung sound ng hangin sa labas. Pakinggan mo yung breathing mo sa nose mo. Or kung kaya, pakinggan mo yung tibok ng puso mo. Just to focus your attention away from the fear. As I've said, I've mentioned psychological first aid. Ito yung ginamit na namin na acronym no, lipat, alinga. Lumapit at kumustahin ang individual, hindi ng kanilang nararamdaman, nararapat na mga pangailangan ay dapat tugunan, etc. etc. Bakit may psychological first aid? Kasi hindi naman lahat pwedeng pumunta sa mental health professional. Itong psychological first aid, first aid, iniiwasan na, ini-stabilize natin yung mga kasama natin. And may training po ito that we are willing to share with Nueva Vizcaya State na University, including the suicide first aid. No? Pag-usapan po natin po, malaki po yung maitutulong nito. Through the training, matututunan natin what to say to someone experiencing a mental health problem. Diba? Meron tayong mga kaibigan. Minsan, masama yung loob natin, bumagsak tayo sa isang exam, sasabihin sa'yo, okay lang yon, kayang-kaya mo yan. Hindi po siya invalidating yan. Hindi madaling bumagsak. No? Pag hiwalay sa girlfriend or boyfriend, wala yan. Kayang-kaya mo yan, di ba? These are all included in the psychological first aid training and makikita po ninyo. No? But these are just some of the not so helpful na mga hirit, no? Na we just need to be aware of at huwag ginagawa. Kasi mas nakakasama eh. So, this is a marathon. No? Lagi ko pong sinasabi is let's prepare for a marathon, not a sprint. Ito pong COVID-19, itong problema natin, pwedeng magtagal, baka magtagal. Kaya nga marathon. Sino sa inyo nakarating na ng marathon? Dahan-dahan lang, mahaba yan eh. Hindi mo kakayanin pag pinag mo, mapo-burnout ka. Hindi tayo magpapaunahan. But only together can we survive this pandemic. So it's a marathon, not a sprint. Ask for help if you need it. Okay to ask for help. Asking help is not a sign of weakness. Our main goal right now and in the next 3 to 5 years maybe, let's stay alive. Eat healthy, be strong, get vaccinated, no? Practice minimum health standards. When to seek professional help? When you feel that you're no longer yourself, when you're struggling, doing maladaptive coping, and not enjoying life anymore. DOH Regional Helplines po ay meron. Yung sinasabi ko pong good news, yung hotline po namin is available po sa Vizcaya. Testing na po namin. Free po ito sa landline or even using your smart. Yung Globe wala pa. But yung numbers po ibibigay ko later. Kasi po, tinitignan namin hindi kasi lahat pa ng areas para sa Vizcaya ay pwede. Pero meron na kaming mga nasubukan. So, i-share po namin yon. So with that, thank you very much. And I just prepared a short presentation. I am very much excited to really listen or I'll be waiting for your questions. Mas maganda po na interactive tayo. So again, a pleasant good morning to everybody.